Hi, and we're live now. We're actually in 1 second. Okay, we're live.
Okay, welcome back everyone, and welcome to another session of Pre-Dental Universe. I'm Tiffany, one of the pre-dental students monitoring today's session, along with Sherry, and we have an exciting presentation today with Dr. Rodrigues. And before we begin, we just want to thank Dr. Rodrigues and for sharing your experience and some of your professional insights with us. And on that note, feel free to take it away whenever you're ready, Dr. Rodrigues.
Thank you. Thank you, Tiffany, for introducing me, and thank you for the having me and for the invitation. So my name is Manuela Rodrigues. I'm actually in Europe. I'm Portuguese, 43 years old, and I'm currently living in Belgium. So I'm speaking to you from Belgium. And I'm going to start by telling you a little bit about my journey. So I was admitted in dental school back in 95. I finished my dentistry university in 2004. And my time, the dentistry course was of 6 years. Nowadays, here in Europe, it's 5 years. And if you want to continue, you'll do the master's. So I chose dentistry because I had this romantic idea that I wanted to make people smile. And I had always very good experiences in my dentist with my dentist, and so I loved going to the dentist, and no one in my family was a dentist or had any connections in the field. But at the time, I loved biology. I loved the idea of working with people, and I also wanted to be independent, and I wanted to make sure that I did my studies in something that could guarantee me a job and a good living. So dentistry seemed the perfect combination of all these factors, and I got in. I cannot say that it was 6 easy years. Maybe for some dentistry students, dentistry school is easy. It was not for me. I never failed. I still am very organized. I have study methods. I love to study. I love to read articles but the hard part was that I was never very confident. I was never a very confident dental student. And sometimes I felt overwhelmed. I remember I have this strong memory to throw up before clinic exams with patients when I was being evaluated. So everyone was better than me. I had a little bit of a confidence issue in my work during dentistry school. So I finished, and I started working right after I graduated in Lisbon, in Portugal, as a general dentist. I had my learning curve, and I became more confident in my work. What I decided from the beginning in my dentistry clinic work was that I was not going to perform any treatment that I felt I was not going to do a good job, I felt that I was not going to perform the best for the patient. So, for example, if I had an endo treatment that I realized that it needed the microscope, and we are talking 20 years ago, I would send it to a colleague that had the microscope that could perform it better than I. The same thing with surgery or periodontics or children. So I was always very aware that dentistry needs to be specialized, and I believe and I stand for it that dentists should find their passion in dentistry and do that. Because if you love aesthetics, but if every time you have to do an endo treatment, it makes you hate your job, then stop doing endo, send it to a colleague and that actually enjoys the endo treatment, and just get really good in doing the aesthetics if that's what you love. So anyway, I worked in Portugal until 2014. And in 2014, there was the possibility for me to go to work to Belgium, and I accepted, and I came here to Belgium to work. Also as a general dentist. So in Portugal, there is already a situation of working on weekends, long hours of work, short appointments for you to see more patients. In Belgium, there is still a different approach. You can choose your agenda, your working hours, depends of the patient needs. No work on weekends or until late night. And I have to say that when I moved to Belgium, I was already looking for a different approach in dentistry. I mean, to really because there was times that I felt exhausted, both physically, mental, and also emotionally, because dentistry is very demanding. So in 2015, I was already in Belgium, and I attended a workshop of mindfulness in the dental office. It's something that they have here in Belgium, a one-day workshop for dentists, and as a stress reduction tool. And I had already mindfulness and the meditation practice of my own. But from that moment on, I started to apply mindfulness in my daily dentistry practice in the office. I started to be more aware of myself, of my body while working, of my thoughts also. I started to practice active listening with patients. I stopped multitasking, and I discovered that I spend my days just reacting, sometimes in automatic pilot. Because one of the things that you are going to discover when you start working with patients is that dentistry has a big component of routine. So the technical part mainly. So if you don't make the effort to pay attention, you start to engage in the autopilot mode. So I was able to regain the control of my practice. And because I felt this transformation, I decided to go a little bit deeper, and I started to read the studies about the science behind mindfulness, because at the time there was still this idea of mindfulness being a new age thing. So in 2016, I applied for the teacher's training as a mindfulness-based stress reduction teacher. I got accepted. I did it together with my work as a dentist. I could combine it. And 2 years later, I got the certification, and I already had started to work with colleagues, teaching them mindfulness, and I just continued to doing. I started organizing 8 weeks courses for groups of dentists for stress reduction, and I had amazing feedback. So after the course, there is this connection again with the profession, and we can grow skills like emotional intelligence, compassion, focus and concentration, assertive communication, curiosity also, and we can really start working from a place of clarity instead of a place of reaction or a place of fear and insecurity. So I created my mindful dentistry training, which is a combination of the mindfulness-based stress reduction with all the years of knowledge that I have in dentistry. So in the early 2019, I decided to pause my clinical work and dedicated myself 100% to teach these skills to dentists and to help them to better deal with stress and to allow them to take their dentistry practice to the next level. And the mindful dentistry training was officially born. So in my program, I teach dentists to not only better manage stress during their everyday dentistry practice, but also to work from this place of attention and flow, to learn how to be more present and aware during their work, and of course, to make better decisions from this place of clarity. Because that's what mindfulness is the quality or state of being conscious and aware in the present moment. So today's possibilities are endless. The scientific knowledge is evident, and there are so many paths to choose from. With all the technology, with all the technical part and the different treatments, we have so many possibilities to better treat our patients. So that's why making decisions is so hard these days. But the result of those decisions can have a great impact for your patients as well for yourself as a practitioner. So if you adopt this philosophy to your dentistry practice, to your everyday moment to moment practice, mindfulness will naturally be one of the cornerstones in your work. And that's my journey of 20 years. So I love dentistry. I'm passionate about it, and nowadays I feel I'm serving it better by teaching and supporting other colleagues. And that's what my presentation. I'm going to start now my presentation, and what I've prepared for you is a little bit the reason why it's stress management so important in dentistry, because dentistry has been identified as a highly stressful profession. So and I wanted to, the reason why this is so important. It's because if you learn to manage stress, then you are going to be able to live and experience your dentistry career in a totally different way. So this is going to be a little different from what you are used to, probably, but it will make all the difference, because this is not usually taught in dentistry school. This is not something that is talked about in dentistry school. In dentistry school, you will learn about the technical skills, which are very important, of course. But stress management, emotional intelligence, self-awareness, compassion are the skills that will allow you to step into your full potential and take your dentistry practice to the next level. So that's where I'm going to start. I'm going to start by awareness. So nowadays we live in this fast pace with all kinds of external stimulation, and this is common to everyone, not only to dentists. So in our case, we have an incredibly stressful job. So dentistry is a profession that creates many triggers and often has us spending most of our day in fight-flight mode. So dentistry has been identified as a highly stressful profession, and this is something we need to raise awareness to. And I'm sure that this doesn't come as a surprise to anyone. I'm sure that you as dental students already feel a little bit of that, already feel the pressure, already sense the demanding of perfection, the commitment that is required and demanded, but somehow this is still considered irrelevant. So these are some of the studies that show some of the numbers, and these are just some of the most recent ones. If you are interested, I can make them available for you. But the fact is that dentists are widely reported as finding their work stressful. And spoiler alert, you are going to feel that stress also. And before I go on, let me tell you that this does not mean that dentistry is not a wonderful profession. It is a beautiful and very rewarding profession. It is a meaningful profession, and we have the opportunity to make the difference in people's life and actually to make a good living with it. To be aware of the other side, because the job comes with stress. It's not possible or even desirable to talk about a stress-free dentistry practice. It is, however, possible to learn how to better respond to the stress and to reduce it. So one interesting fact is that the stressors are remarkably consistent across time and country of practice. So if you go back to the studies in the 70s, you will find the same stressors as the studies in for example, from 2 years ago. And also, you will find the same stressors in dentists from New Zealand, from Japan, from Europe, from the US. So they are very consistent. So let's see what are these stressors. So these are the biggest identified stressors in dentistry. And this is not by any special order. These are just the major ones. So running behind schedule, or when you have emergencies during your day that were not scheduled in your agenda, striving for technical profession, causing pain or anxiety in patients, canceled or late appointments, lack of cooperation from patients, managing patients' expectations. So as you can see, patients are a big one, a big stressor in dentistry. Fear of failure, fear of complaints, fear of getting sued, dealing with constant demands of compassion, of understanding emotions, and of course, to be able to have emotional control. All these three leads to exhaustion, financial pressure, isolation, performing treatments outside your comfort zone, patients' unfavorable perception of dentists, unfavorable perception of themselves, and this has to do with the imposter syndrome, which is very present in dentistry also. Concerns about the future, inadequate assistance, communication problems with patients or with your team, career expectations, patients not opting for ideal treatment, too heavy workload, and regulations and government control. And I'm sure that even this being a long list, there are still some stressors missing here. I'm also sure that when you start working, you will find yourself struggling with these situations. So, what is the repercussion of all of this? What does this stressors cause? So 80% of dentists suffer from some degree of stress reaction. Okay? And this is significantly more than when compared, for example, to other groups of physicians. And this means that there are consequences from this stress in dentistry. And the consequences are, of course, for the dentists and for their work and for their patients. So the consequences can be physical consequences, personal consequences, and emotional consequences. So let's see those consequences. So first, the effects of stress on dentists' physical health. The four major physical health effects of stress in dentists are muscle and skeletal disorders, cardiovascular diseases, anxiety and neurotic symptoms, and exhaustion. Okay? And all of these result in one of two things, or in both: job unsatisfaction and in the premature retirement of the dentist. Actually, the main reason from premature retirement among dentists is stress and anxiety. And dentists often reported to feel exhausted in the end of each day. I observe it in myself, and I see it every day with the colleagues that I work with. So second, effects of stress on personal and occupational performance, and this is burnout. So when stress is felt in a negative and extreme way, with little or no feeling of control, the continuous contact with patients and staff can lead to burnout. Professional burnout is a long-term consequence of occupational stress and, of course, causes work incapacity. So, third, maladaptive coping strategies. Addictions or substance abuse are maladaptive coping strategies. Alcohol is the winning one among dentists. I often listen to colleagues saying, yeah, I cope with stress with a glass of wine. So nothing wrong about the glass of wine. I enjoy it also, but that's not a coping strategy for stress in dentistry. Okay. Confidence in how you, in being ready to handle and manage patient expectations, for example, is a good coping strategy in dentistry. Having control on your is a good. So a glass of wine is not a coping strategy. And of course, dentists that report more effective strategies to deal with stress experience fewer health problems. So fourth, at the extreme of burnout or depression is suicidal behavior. Dentists have been recognized as a group with a high incidence of suicide. And the last one, and a not so known one, is the called labeling effects. And this has to do with dentists developing this lack of sensibility for anxious patients. So at a certain point, it's all the same. It's just another patient, and emotionally, there is a lack of perception from the dentists. It's also described that dentists cannot differentiate from general anxiety from dentist's anxiety. So, and they assume that everything is dentist anxiety, and they tend to avoid certain treatments, certain patients, or to overtreat with general anesthesia or sedation. So basically, with time, we start labeling our patients. We assume a certain behavior and expect a certain behavior also from them. And of course, this leads to assumptions and judgments. And it leads to frustration, both from the dentist and from the patient. And these are the 5 major consequences of the effect of stress on dentists' physical health and life. And as you can see, they can be life-threatening. So let's talk about solutions. Let's talk how we can better cope with stress in order to avoid these consequences and to live our profession with joy. So you don't have to live your profession in constant flight-fight mode. Stress is a response to overwhelming negative emotion that we experience every day at our job. The anxiety that is underneath that stress can result in poor decision making or in maladaptive coping strategies like more working hours or alcohol or there are so many. But all of this will only lead to more stress. So you can learn to respond instead of reacting. You can learn to respond more wisely to your emotions. You can develop more adapted responses, and you can work from a place of clarity and flow instead of a place of tension. Okay, so the goal of coping with strategy is to offset the negative effects of stress, right, by using appropriate coping strategies. So, and this coping can be done by participating in, of course, in activities that make you feel better, spending time in nature, physical exercises, hobbies, meditation, quality time with family and friends, sleep and eat well, which is a big one, a good self-care routine. So dentists are intelligent persons. So you don't go through and finish dental school if you are not intelligent. So you will also have to be intelligent in taking good care of yourself. And the pillars for taking good care of yourself are good sleep, daily movement, nutrient, natural food, healthy mind, good relationships, and of course, healthy, clean environment. So physical exercise, for example, it's very, very important. It's very important to have some kind of physical activity, even if it's just walking, but to move your body, because it's develop also great self-esteem, self-control, self-discipline, and it will help you to burn up the additional supply of adrenaline that results from stress. Of course, it also depends on your personality, and if stress can have a bigger impact in certain persons than others. Those who have a strong positive self-image and know how to relax and how to reduce mental and emotional pressures also cope better with stress. And a very important one also is for you to be open to being helped by others. So stressors as failing to meet personal expectations, seeing more patients for financial reasons, working quickly to see many patients as possible for financial reasons, earning enough money to meet lifestyle, or being perceived as an inflictor of pain. These are all stress-producing situations, as we saw. And if you are going through this, you also have to realize that you might need help to deal with all of this. So another thing that you can do, of course, is stress management courses or workshops. Learning breathing exercises, learning about progressive muscle relaxation, joining a meditation group, learning about emotional awareness or emotional intelligence, learning about business management or time management, learning about assertive communication and active listening, learning about compassion. All of this will develop the soft skills that you also need as a strategy for coping with stress. I want to just make a brief note about the muscle skeletal disorders, because this is the most common health problem reported among dentists. The muscle skeletal disorders lead to chronic pain. And of course, chronic pain is a major stress factor. And it has been reported that young and less experienced dentists experience more muscle skeletal disorders compared to older and experienced ones. And the common muscle skeletal disorders are low back pain, shoulder pain, hand and wrist pain, and headaches. But the low back pain is more prevalent than other types. And we all know why this happens. I mean, the picture that I have there, you can see that the dentist is working and the mouth of a children is completely turned. So, so it comes with a job also. But prevention includes maintaining a correct body posture while treating patients, taking adequate rest, doing some exercises. There are very simple stretching exercises that you can do between patients or 2 times a day during your work day, and they will make all the difference. But you have to do them from the beginning. You have to create that routine. That's very, very important. Your body, your hands are your biggest asset. So you have to take good care of them. Of course, your body, your hands, and your brain, of course. And finally, I want to give you some practical tips for you to start applying in your patients when you will start seeing patients in the future, that you remember this and you start applying some of this practical tips. And this is a testimony from a colleague, a dentist that attended my my dentistry stress reduction course. And she said to be able to master many technical skills and very different areas of knowledge, and at the same time to be aware and have control over the patient physical, psychological, and emotional well-being while a demanding treatment takes place, giving the impression that everything is fine and easy. It's exhausting. So in dentistry, in an appointment with a patient, there is a lot going on. So maintaining focus through a dedicated appointment of challenging work, sometimes with an anxious patient, it can be hard. So it's not as easy as going for it. So you will be under mental strain, you will be under fatigue, and challenges might come up. So especially important practical tips. First, don't multitask. So we often tend to think that multitasking is a great way to get multiple things done at once. But we are really just switching our attention back and forth, just perform one activity at a time from beginning through the middle and the end before beginning another. Truly engage with how you are spending your energy. So second, pay attention. And this is why mindfulness attention. So not only to what in front of you, but to what you are doing, but also through your thoughts, your emotions, your body sensations, your breath, the environment that is surrounding you, your patient body language also And this helps to listen, for example, in an active way, to observe carefully, and to make better conscious decisions. Third, simplify your surroundings and make sure you are not interrupted. Okay, so if you are working in the patient's mouth, and if someone comes and interrupts your focus, or if your phone rings, or someone walks in the door and the nurse or a colleague comes asking a question, all of these are distractions. So for trying to work in the patient mouth and paying attention to someone talking, or to a phone ringing, then you're going to have your attention back and forward, and that's when things might happen. That's when you can contaminate the isolation field. That's when you can cut a tongue. That's when you can cut too much in a preparation, and then and a lot of things can happen, and then you get frustrated, and then your appointment turns into this unexpected mess, and then it goes from one half an hour appointment to 1 hour appointment, and just because you turned and you just said hi to the person that walked in. So losing focus can cost a lot in dentistry, okay? And this is mainly a mental game. So you have to simplify your surroundings. In dentistry, there's a lot of information that we process at the same time. And it's not just visual. There's audio cues, there's the way the motor feels in your hand, the way that the instruments feel in your hand. There's, there's the awareness when you see the patient, clenching or closing his hands, and that might mean that they are starting to feel something, that they are in pain, and that you need to do something. If you are distracted, if you are not present, if your body is there but your mind is somewhere else, you're going to miss that. So all those details make all the difference. There are subtle little cues, but they make all the difference in your work, and they can take your work to the next level. So here's what's useful also. It's for you to recognize when the autopilot takes over. So when your mind is somewhere else, or when you are distracted, you have to be able to recognize that and to come back to a place of groundness and work from that place of groundness and presence. Because that's where you have to be. That's and your patient is going to feel that you are really there with him. And like I already told you, and you are going to see that for yourselves when you start working, at a certain point, dentistry, it has a lot of routine. So there will be treatments that you're going to start doing hundreds of times. And you can even think, okay, I've done this procedure for 1 million times already. So why can I not space out? So the habit of being lost in thoughts can also mean that you are missing the parts of your work that make the difference, and also the joy of being creative, an opportunity to solve a problem in a different way, or just the look of gratitude of your patient that it was just in that moment. And how many other things you could be missing. So be present and be able to recognize if you are an autopilot, disconnect from the autopilot and engage in presence. And the other two is to create a stretching routine that works for you during your day. It's very important. And to take breathing pauses. And the two last one will in a very simple way, activate the parasympathetic wing of your autonomous system. And this will balance the stress cycle. So another situation that I had described by a colleague, when a procedure is not going to plan, struggling. One day I was struggling with an extraction. I once got a splint stuck in someone's mouth. So, and this is everyday dentistry. Sometimes it's messy. And the key word here is struggling. And again, it's not realistic or even desirable, the concept of a stress-free dentistry work practice, okay, or a stress-free dentist. Stress is a natural part of dentistry work. The big question here is how to respond in the face of stress, how to respond when something like this happens. So the first step is not action, but awareness. So when we find ourselves in a situation where a procedure is not going according to plan and we start to struggle, normally reacting, trying to solve the situation, the problem, of course, what happens is that we completely disconnect from our body. We are just inside of our heads trying to solve the problem, and our vision narrows, our critical thinking narrows, and our creativity disappears. Okay, and that's why sometimes instead of solving the problem, we even make the situation worse. Because we are trying to solve it in a way that doesn't work, not paying attention to the big picture, and sometimes it even gets worse like this situation. So the first step, it's awareness of what's going on. We actually need to pause for a few seconds. We need to recognize the situation. We need to recognize our body tension. We need to look up to take a deep breath. We need to ground ourselves in our body again, releasing muscle tension. And this allows us to return to presence, to work from a place of presence instead from a place of a mindless reaction. And as we do that, there is a natural releasing that opens not our body, but also our mind, our critical thinking, our creativity, our ability to collaborate and problem solve. So relaxing happens naturally as we direct just a gentle awareness to the tension that is happening in us, and learning to release our tension through this conscious relaxing is an important skill that brings our full intelligence and creativity. And this, of course, can be learned like any other skill. So let's take this a little bit further, because what happens, it's because dentistry is a profession that creates many triggers. What happens is after that extraction that didn't go according to plan, you are running late in your agenda, you have already patients waiting, you have to deal with anxious patients after, and the nurse comes in and saying that the lab called that big work that was scheduled for tomorrow is not going to be ready. So if you are not aware of it, you will spend your day in the flight-fight mode, really tense. So if we spend our days in the states of overstimulation, there will be a constant flow of cortisol in your body stream, and you will start to feel the physical symptoms, okay? Insomnias, high blood pressure, gastric problems, heart diseases, muscle pain. And because people handle stress in very different ways, it might be in the form of maladaptive coping behaviors, of compensations or emotion burnout, or overworking, and at a certain moment, of course, all this spending our days in this state can affect our health. So being able to recognize the stress triggers can help you manage them, and being able to bring relaxation to balance the stress physiological response is very, very important. And of course, this can be done in two levels. The first level is when you are at the situation, just like I have described in the situation before, to respond in the face of stress, to be able to pause, to ground yourself, and to choose a helpful response rather than just reacting automatically. The second level is with the adaptive coping strategies, mechanisms that you can develop outside the practice, right? So the exercise, the meditation practice, hobbies that bring you joy, good sleep, good food. So to develop this good adaptive coping behaviors that will help you to break the stress cycle and help you to be better prepared when you start your working day. And this is actually what we are talking about, is to intentionally activate your parasympathetic system. Otherwise, you will live in a chronic state of overactivation of your sympathetic. So conscious attention to the parasympathetic system brings first of all, it closes the stress cycle and it brings equilibrium. And it's already a lot, but I hope you're not overwhelmed. That's enough information. Otherwise, you'll get overwhelmed. I hope this was of use for you. And if you have any questions, I'm available to answer them.
Yeah, thank you, Dr. Rodrigues. This was a very informative and helpful presentation. And thank you for taking the time to be with us today and preparing this presentation as well. And it was very interesting to learn about like how to manage your stress and how different stresses dentists feel like in their practice. So with that said, we have a few questions for you in the chat, if that's all right.
Yes.
Okay, to start off, in order to work in another country, did you have to get recertified in order to practice?
Not in Europe, no. If I'm going to, if I want to work in the United States, I cannot, or in Australia, I cannot. But here in Europe, you can do it. For example, for me to come to Belgium, all I had to learn was the language. So it's demanded for me to have the B1 Netherlands, which is Dutch language. But no, you can work in all parts of Europe. You don't need anything else.
Thank you, Dr. Rodrigues, for answering the question. Another question is, what do you specifically do during your workday to be less stressed?
Well, breathing pauses between patients, it's very, very important. Stretching exercises, it's very important also. Lunchtime, not in the practice. I always go, even if I eat something at the practice, I always take at least 10-15 minutes out of the practice to walk and to get some fresh air. It's very important to control your agenda and your time and to manage your time. If one of your stressors is being late on your appointments, then you have to see how much time you need on your appointments in order to not get late, right? So simple changes like this make all the difference. To have time
Yes.
to listen to the patients, it's very important.
Yes. Thank you, Dr. Rodriguez. So another question that is up in the chat is, when you're doing a treatment plan for a patient, how do you keep the patient from being anxious once you're, telling them all the procedures that will take place?
Well, that depends of the it depends of the patient. But you have to be able to first of all to have time, and second, you have to be able also to how can I say this? It has to do a little bit with the labeling effect that I talked to not do everything in the same way. So depending on the patient, then depending of the way that you talk with him, and you have to really use language that the patient understands, because if you use technical language, then he will not understand. So you have to be able to put yourself at the same level as the patient, and of course you have to have time to do this, so that he feels that you are that he's being taken care of.
Yes. Yes. Thank you.
Thank you, Dr. Rodriguez. So the next question is, are there any techniques that you use when dealing with uncooperative patients and patients with mental illness?
Well, that comes to what I said. I think that there are colleagues that are specialized to work with those patients, and I think that's always better to be done by specialized colleagues. But when a patient is not cooperative, you have to see if, for example, sedation or general anesthesia is a solution. It depends why he doesn't cooperate, but it depends of the patient, of course.
Thank you, Dr. Rodriguez. So, we were also wondering, what do you do to overcome, in the chat here that says, what do you do to overcome lack of confidence?
Yeah, you have to grow your confidence muscle. You have to grow your confidence muscle. You have to really put yourself out there and work from a place of confidence. And that has to be with recognizing your thoughts, and not to be able not to let them get you and put you down. And you have to do exercises to build your confidence, because confidence is a muscle. But if you are prepared, if you are confident in your work, and if you really work on your inner critic so that it's not loud, the confidence will come.
Thank you, Dr. Rodriguez. And can you discuss about the differences between like being a dentist working in Portugal and in Belgium?
Yeah, I mean, it's basically nowadays. I think I said it in the beginning. There's a different approach regarding for example, the working hours in Portugal nowadays. There are clinics that are open all days from Monday to Sunday, so 7 days a week until late hours in the evening, with appointments every 20 minutes, and you have to see this number of patients and to make this money in the end of the month or of the week, and it was not something that I didn't want that for me. So here in Belgium, you still don't work at weekends. You still have your schedule from 9 to 5. There's no appointments until late hours in the evening. And there's still the liberty for you to build your agenda the way that you want. So if you feel like you need 1 hour to a patient, you can schedule 1 hour for that patient. If you think that in the next appointment you need 1 hour and a half, then you schedule 1 hour and a half, and you still have the freedom to do that. So, and I'm not saying that dentistry is like that in every place in Portugal. Sorry, but yeah, due to economical reasons, and sometimes dentistry has a very strong economic pressure, that can happen.
Thank you so much for your response, Dr. Rodrigues. We have another question, and it's asking if you could describe how you felt, or how did you perform the first time you had a patient?
Oh, I remember that very well. I even remember the name. It was a man, and his name was Victor. I was very nervous. So I remember actually my first two patients. The first one that I had in dentistry school, and the first one that I had outside dentistry school when I was already a dentist in the first practice that I worked with. So in both cases, I was very, very, very nervous and anxious, and in the first case in dentistry school, I don't think I even know what I was doing. But it was a very simple treatment, of course. But I don't remember as being bad experiences. I remember as being, of course, anxious, and of course with fear. But I also remember of being happy about doing, and I knew that it was going to be a starting point. So that was nice.
Thank you, Dr. Rodrigues. That is nice. So another question I have here is, what gets you excited about coming to work every day?
The patients and the environment, and the reason that I find meaning in my work, and I enjoy what I do.
Right. Thank you.
Kind of piggybacking on that question. So, what do you find most challenging about being a dentist?
There's many challenges. I think I have to say two things. The first thing is, of course, to manage patient expectations and my own expectations. And the second thing is to find balance between my professional life and my personal life, because that's hard also.
Thank you for answering the question. Another question is asking if you had the opportunity to come to the US to work, would you take it and why or why not?
Well, I would say no. Because I mean, if I could practice dentistry there without going through dentistry school again, yes, but that's not possible. So I would have to do part of it again, and going through that again, you guys know because you are going through it, it's hard and it's not something that I want to do again.
That is totally understandable. So the next question is kind of segueing off of this. So if you could go back and provide like any advice to your past self during dental school, like what would you say?
I would say to be more confident. I would say to be more confident. And I can now see that the reason why I was not confident was because I let myself be ruled by all these thoughts in my mind. So, for example, when I start in dentistry school, when I start seeing patients, every time I had a patient, I remember all these thoughts in my mind about all the things that could go wrong, and they had much power on me. So, and this goes back to the confidence question. So if you are aware that these are just thoughts, you can interrupt them, and you don't let yourself be ruled by them, and you can actually choose to work on confidence. So that's what I would tell myself, to work on my confidence, and just to ignore my inner critic.
Thank you, Dr. Rodrigues. Another question that they had in the chat would be, how do you motivate yourself to fight against burnout?
Well, you really have to watch for yourself. You really have to do all the work outside the practice. You really have to have a really good self-care routine. You really have to have time to rest. And it's not only to sleep. You have to have good sleep. That's very important. But you really have to relax your muscles. You really have to relax from noise. You really have to relax from the screens, and you really have to give yourself the chance to rebalance. And otherwise, you don't see the signs, and when you realize you are already in a place of exhaustion. So you have to be able, not only during your work day, to like I mentioned those tips, like don't multitask, really be present, recognize when you are in autopilot, have a stretching routine during your work day, take pauses to breathe between patients. During your lunchtime, go outside for 10 minutes and just walk and get some fresh air. But outside the clinic, you really have to watch out for yourself. You really have to be able to disconnect from work and to really relax. Otherwise, if you take your work home, if you cannot rebuild of exhaustion, then you're going to start to feel the effects, and that will lead to burnout. So it's all about acknowledging the importance of your body. Not because sometimes we think that our mind is the most important thing, and it is, and you should train it, of course. But if your body is tired, then you cannot work also. So you have to find this balance, and you have to have the intention on 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 taking good care of yourself.
Thank you so much, Dr. Rodriguez. So that is actually all the time that we have today for questions. So I just wanted to thank you again for taking the time and answering them all. And thank you to everyone who joined us today. Just before we end today's session, the link for the quiz we posted in our group me. So yeah, make sure you guys tune into our next session. And thank you, Dr. Rodriguez, for your amazing presentation about stress and how to manage it. And that's all we have. Thank you.
Thank you.
Thank you.